Barack Obama can't help smiling. On March 23, 2010, he succeeds where all American presidents before him failed, creating a semi-universal healthcare system. The Affordable Care Act is born.
This year, tens of thousands of uninsured Americans with pre-existing conditions, the parents of children who have a pre-existing condition, will finally be able to purchase the coverage they need. That happens this year. This year, insurance companies will no longer be able to drop people's coverage when they get sick. They won't be able to place lifetime limits or restrictive annual limits on the amount of care they can receive. This year, all new insurance plans will be required to offer free preventive care. And this year, young adults will be able to stay on their parents' policies until they are 26 years old. That happens this year. And we have now just enshrined, as soon as I sign this bill, the core principle that everybody should have some basic security when it comes to their health care.
Far away from Washington, D.C., the small town of Mosinee, in Wisconsin. This is where Brent Brown grew up.
Hello, my French friends! Welcome to Mosinee!
2 years ago, suffering from colitis, an autoimmune disease that destroys bowels, he nearly died. Last March, he finally met the man who saved his life.
I am a Republican who cursed his name, who falsely accused him, and someone who zealously worked to ensure that he would never be my president. But thanks to his fortitude, thanks to his unwavering vision of mercy, even towards me, this chump gets a second shot at life. It is my great pleasure and honor to present to you the man that saved my life and the president of this great United States of America, Barack Obama.
Before the Affordable Care Act was passed, no insurance company wanted to cover Brent. Why? Because of a pre-existing condition he found out about when he was in college. Every year, 40,000 Americans die because they can't afford health insurance. For a devout Christian like Brent, this is simply unacceptable in the wealthiest country on earth.
To me, it is a right of the citizens of every country, but in particular Americans. I'm an American. We are a family. We should take care of one another, regardless of whatever that happens to cost us. One thing that ultimately bothers me in this discussion, where Obamacare, the ACA, or just in healthcare in general, is that some people start from the incorrect question, which is, how much will this cost? At which point you're placing a value on a life. And yet if I were to go to those same people that ask that question, they start the conversation there, and I ask them, what value is a life to you? Almost universally and unilaterally, those same people that ask that question are going to say, priceless.
This reform saves lives then, and changes lives. Obamacare was partly initiated here in Portland, Oregon. In 2008, researchers led an experiment, expanding Medicaid, the health coverage for very low-income families, to 30,000 people who had no insurance at all. A huge sigh of relief for these low-income patients.
Those financial strains, those tough decisions between, food, rent, or medical care were much reduced. And I think the last thing we found is that just people were better. They felt better, subjectively improved health. We had some objective measures of depression and other things that showed big reductions. So had some profound health impacts for people as well, especially around sort of mental health.
On the other side of the building, Dr. Clark is meeting with one of the patients.
Dominique, hi. Nice to see you. How have you been?
My husband's been a little rocky.
Oh, has it? Oh, darn. I'm sorry to
Since
hear that.
2010 and the gradual implementation of the reform, she's been very enthusiastic about it.
I think it's a wonderful reform. I've always cared for a lot of uninsured patients and a lot of lower income patients. So for me, it's made a tremendous difference to be able to provide them with the care that they need. As a doctor, we want to do the right thing by our patient, and it's very frustrating when we have a patient that we know the care that they need, yet we're not able to deliver that care. So I have found it personally a very, very rewarding thing.
Like with Dominique, who suffers from asthma.
Okay, so there I'm here. Okay,
Getting a health coverage used to be unaffordable to her, so Obamacare came as a kind of a miracle.
I believe now that I'm in very good health. I was healthy enough to have a baby. That was my goal, to be healthy enough to have a child. I can put money towards my son. I can save money. I can save money towards a house. My medical debt was ranging between $15,000. I don't believe anybody should have $15,000 worth of medical debt.
And so what it is now?
Right now it's probably $350,000.
20 million Americans have recently been able to get health coverage. This represents the single biggest increase in the history of the United States. However, the majority of Americans keep being hostile to Obamacare. In the small state of Delaware, these Republican supporters are mobilizing for the November elections.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands.
Ruth Briggs King is the state representative for the 37th district. Along with many Republicans, she thinks of Obamacare as an abomination.
It has been very expensive for the state, for one. When we look at what's happened to Medicare and our cost for that, we're facing significant cost in Delaware to Delaware taxpayers, which means if you're taking from one account to try and make up for the difference in balancing the budget. So I think we're talking about 25 to 28 million in this fiscal year alone. It's been very costly for business. The regulations and red tape alone that a business is having to fill out, the forms, the proof. And then comes the real pinch is to the actual taxpayer, the citizens of the United States that are having to be penalized if they don't take it out.
It is the most controversial aspect of Obamacare, the individual mandate. Every American is now compelled to buy health insurance. Otherwise, the fine may rise up to $2,000. A crime of less liberty for these conservatives. But young Republicans tend to see it a different way.
I think Obamacare is an issue that matters, just in a way where we'd just rather have it in the private sector. We're not going to be like, attack it, but more like, okay, let's just make it more accessible, not force us to do it. And I just think it's a party where we're a little bit more, have become slightly more tolerant than the older party has.
Donald Trump's promise to repeal Obamacare could mean the end of Obama's main achievements. In the meantime, 19 Republican-controlled states have not yet expanded Medicaid to low-income households, and 29 million Americans remain uninsured.